Dear Chair, dear ladies, dear colleagues and friends, thank you very much for the possibility to present our experience in thermography for peripheral vascular disease. In fact, the peripheral artery disease is a global non-infectional pandemic, and it's a significant indicator for generalized atherosclerosis and a strong predictor of future myocardial infarction and stroke. Unfortunately, the first line method, Ankle-brachial index, is not readily available, and not only that, but in almost half of the cases, because of the medial calcinosis, is even not possible to be done reliably. The other possible method for peripheral arterial disease screening, the pulse palpation, is neither the best one. You see how low is the sensitivity and specificity of this operator-dependent method. So what do we need to early recognize patients with peripheral artery disease? It has to be non-invasive and safe, without radiation and contrast, quick and reliable, not to be operator-dependent, without physical contact in the context of the recent pandemic situation, and possibly cheap. For us, this is the thermography. In fact, the infrared thermography is laid down as an idea 2,500 years ago, when Hippocrates told us that should one part of the body be colder or hotter than the other, disease is present in that part. Unfortunately, the first data since the last century of application of thermography were abandoned because of the low rate of specificity and also resolution. But nowadays, after the pandemic situation, raised the interest and improved a lot in fact the technology. With the help of this Bulgarian technology based on artificial intelligence analysis of the thermographic pictures, we have improved a lot the results. In fact, the infrared thermography was applied in peripheral artery disease in several trials, both for screening, like shown here, and also for follow-up period after intervention, and mainly for diabetes. We know that the population of diabetes is the biggest population that are jeopardized by peripheral artery disease. How the procedure itself is performed? It's extremely simple. In the same position of the object, of the patient, same surrounding ambiental temperature, taking the picture at a distance of 60 to 70 centimeters from the patient, and to repeat the same before and after the intervention. So after taking the picture, there is a thermosegmentation, automatic artificial intelligence-based analysis, and notifying the specialist. So using this convolutional neural network and digital labeling of the pictures, this is improving a lot the resolution and the segmentation rate. We have validated the value of this method in 442 patients, comparing to Doppler, to Ankle-brachial index, and also to digital subtraction angio. And we have achieved to have, depending on the vascular territory, specificity reaching between 82 and 100%. I'm absolutely sure that you can guess what is the underlying vascular condition under this thermal picture. Yeah, you are right. This is a Leriche, thrombosis of the aorta. So, like they said, one picture tells more than 1,000 words. In this critical ischemia of the right leg, we have shown the value of the method not only to detect the peripheral artery disease, but also to show the result after the endovascular intervention. And you see on the right panel what is the situation, the change into the perfusion of the right leg after the recanalization. In this case of a young 53 years old male with a type B dissection, I'm showing our usual way to treat type B dissection with a stent graft and petticoat maneuver with extending the stent graft with a bare stent, with excellent result. Of course, we finished totally endovascularly without cutting with a closure device. During the night, the patient complained with very big pain on the left leg, and the boy that was on duty made immediately thermography, and we saw a critical ischemia of the left leg. And what we have expected, the manta was occluded. So after recanalizing by brachial approach, the manta closed site and the stenting, we have full restoration of the flow by the DSA, and also full restoration of the thermal imaging perfusion by the infrared thermography. In the other case, I'm showing different territories, as you see. In this case of subtotal stenosis of the right external carotid, it's obviously on the right side the lack of perfusion on the face, both on anteroposterior and lateral projection. And this is the situation after stenting the intermediate lesion of the internal carotid, and excellent restoration of the flow of the external carotid, and with full restoration of the perfusion on the face, both in anteroposterior and lateral projection. So, I think that the artificial intelligence, more than obvious, has a bright future in different territories of the medicine, but especially in cardiovascular medicine. I think in the very near future it will be utilized. This method based on artificial intelligence will be utilized not only for screening, but also for showing the microcirculation, and as a tool into the follow-up to show patency rate after surgical and endovascular intervention in patients with peripheral artery disease. And thank you very much for your attention.